only, and that's all. Also, your kids must be between 7 to 16 years old. Registration portal is open and closes December 15th, 2022. Tech training starts
Nigeria info. Once again, good afternoon. Denise Dennis here, and we're going to be serving you conversations from now up until 3 p.m. Yeah, I did talk about what we're talking about for this hour, but then again, I forgot to mention that the 1 o'clock through to 2 o'clock hour will have 30 minutes live appearance, another 30 minutes live appearance. So that hour, that takes care of that hour. But then we'll be back 2 to 3 for Mind, Body and Soul. Today is World's AIDS Day. And we'll be talking about getting tested for HIV AIDS. How many of you know your status? To be honest, think about it. Because I'll try to answer that question within that hour. So, without further ado, let us look at our first conversation. The Medical and Dental Consultants Association of Nigeria have shown that 9 out of every 10 medical and dental consultants with less than 5 years of experience plan to leave the country for greener pastures. Please help me underline the term greener pastures. Just underline it. We'll come back to it. Now, they said the survey carried out in March 2022 by its Medical Education Committee also found that over 500 medical and dental consultants had left Nigeria for developed countries over the preceding 2 years. The association made this known in a statement signed by its president, Dr. Victor Makanjola, and made available to The Punch yesterday. So that survey reported that only 24,000 doctors are currently registered to practice in Nigeria. 24,000 doctors. On the line, 24,000 doctors. We'll come back to it. Given a ratio of 1 doctor to over 8,000 Nigerians against the World Health Organization's recommended ratio of 1 doctor to every 600 people. Somebody say problem. So I am with my calculator and I am doing the math just to be sure. We currently have a population of over 200 million Nigerians. So that's 200, and how many zeros now? 1, 2, 3, 4, 5, 6, 7. So divided by 24,000. Wow. Approximately about 8,333. 1 doctor to over 8,003. So let's just put it at 8,000. Isn't it alarming that we are in short supply of doctors? Now, you would know that this is not the first time we are raising this concern about doctors leaving Nigeria. We had this conversation last year. I think we had the conversation around the COVID-19 pandemic period in 2020. And this is 2022. We are still having this conversation. Now, one would expect that for a nation that is in short supply of registered doctors, let's take note of that, people who are registered to actually practice, not quack doctors. We should be looking forward to having more doctors, who are desirous of practicing here in Nigeria, as opposed to having them leave the shores of Nigeria in search of what? Greener pastures. And that is why the 2 questions I'm asking are very simple and straightforward. Walk with me. Which should be of utmost priority to a doctor? Greener pastures or saving human lives? So I had to go through the doctor's oath, right? They call it the Hippocratic Oath. And generally it states that a new doctor, you're supposed to solemnly swear and promise that you will, to the best of your ability, serve humanity, caring for the sick, promoting good health, and alleviating pain and suffering. Now, when you decide to leave Nigeria, knowing fully well that we do not have enough doctors to cater to the over how many million people here, and you say you are going in search of greener pastures, what have you placed before you as utmost priority? Did you do your research? Did you find out if the place you're going to have enough supply of doctors, as stated in the World Health Organization's recommended ratio of 1 doctor to every 600 people? Or are you putting yourself first? Greener pastures or serving humanity? That's question number 1. Question number 2. Are young Nigerians still enthusiastic about studying and practicing medicine in Nigeria? Those people that wrote JAM or will write JAM, those days when we grow up, what do you want to be in future? I want to be a doctor. What do you want to be in future? I want to be a nurse. What do you want to be in future? I want to be a surgeon. And now it's the future. Do we still have these young Nigerians excited, looking forward to studying medicine, and also practicing in Nigeria. Let's talk. The smart number to call is 070 0923 0923 070 0923 0923. And WhatsApp and Telegram number for your WhatsApp and Telegram messages is 0809 030 6416. Once again, WhatsApp and Telegram number is 0809 030 6416. A quick reminder that we are live on Twitter at Nigeria Info PH, and Facebook page is Nigeria Info 90.3 PH. Go there, watch us live, and do not forget to drop your comments in the comment section. So I have a call coming from Nwachukwu. Nwachukwu is calling all the way from Trans Amadi here in Port Harcourt. Good afternoon, Nwachukwu. Welcome to the sunny side.
Good afternoon.
Good afternoon. Welcome.
I think we have...
Nwachukwu, I can barely hear you. Could you please speak up?
If you check the number of graduates we have, doctors,
yeah,
vis-a-vis the number of registered doctors, I think we have more doctors that are graduates. Yeah,
okay.
They may not have registered
to practice.
Practice, but they can practice us under someone. So in the real sense, the figure we're having are just those that are registered. Both of those that are graduates and they're not registered, they're working for someone. How do you capture those ones?
Okay.
Because the figure you gave is clear.
Okay, so Nwachukwu, let me address that which you just raised.
Okay.
According to the association, the country produces approximately 12,000 doctors every year to meet the required number of doctors in the country. Anecdotal projections indicate that the 3,000 fresh medical and dental doctors on average produced by local medical schools in Nigeria and another 1,000 produced by foreign medical schools still fall far short of the number of such healthcare personnel required to meet the country, Nigeria's yearly medical manpower supply needs.
Registered.
No, we're not talking about just registered. You mentioned those that are not practicing yet because they are yet to register. And this report is saying that...
No, they are practicing, but they are practicing under someone.
And that's what I'm saying. If that's what you're saying, I think those people you're talking about are captured within this other report of the 12,000 doctors produced per year.
Let's do a simple analysis. If you go to a hospital, let's take one of the hospitals in Port Harcourt. Check how many doctors you have there. So if you check how many doctors you have there, check how many big hospitals, or if not even the big ones, every hospital in Port Harcourt has minimum of 3-4 doctors. 3-4 doctors. UPTH has more. I mean, I think very much more than what we're talking about.
But also, Nwachukwu.
So if you check, unless you're thinking about the state, you understand what I'm saying?
I understand what you're saying, but even with doctors, the medical profession has what we call area of specialization. So if we're going to look at...
saying, yeah?
Do you understand? The medical profession has what we call area of specialization. They are public health physicians, they are gynecologists, they are dentists, they are surgeons, they are ophthalmologists. Do you understand? So as much as you think a hospital has a lot of doctors, you may also want to take into consideration the fact that some of these doctors cannot cater to certain cases.
Most of them, like you said, they have area specialization. But most of them have gone through school. Some are surgeons, some are general practitioners, and whatever.
So your argument finally is that Your argument, finally. What's your argument, really? That we have more doctors than we think we do?
That we have more than that.
Okay.
Practicing. You said registered. I'm talking of those practicing. We have more than that.
Okay. I don't think Wachuku paid attention to the other report I read to him. Let's hear from Mr. Zion in Jari. Hi, Mr. Zion. Good afternoon. Welcome to the sunny side.
Good afternoon.
Good afternoon.
Donald Trump, dishonest. These are dishonest citizens of this country. If I should hold them based on that oath they took as medical doctors, there is no reason any doctor should be leaving this country. No reason at all.
Even when the what's the word I'm looking for now? Even where
they have conditions.
Yeah, exactly. Do you remember? I think it was. I remember. The midday dialogue when we had the conversation about doctors complaining of not having adequate apparatus, even protective gear during the pandemic.
But these same particular doctors established their private hospitals.
How many? How many?
No
how many? How many of them established private hospitals?
These same people were people that are trained by Nigeria.
Okay.
With Nigerian resources. Now, ASU is on strike because of them. Federal government is having problems because of them. Now they have graduated. For them to stay back and make the system work, they want to run. The question is this country they are running to, how come they are not producing doctors in their own country? How come America, London, they are not producing doctors to satisfy their needs? There's even now a black market to smuggle Nigerians out of this. The system is not working. Why can't one doctor, through the auspices of NMA, we need a good president? Mr. Zion, be our president. For this reason, good hospitals in Nigeria. This same doctor took the pain, visit labor unions, trade unions, teachers unions, students unions. See, in every nation, it's only one man that cares for the change, and people follow him.
Mr. Zion, Mr. Zion,
yes,
can you hear me? Let me pick your brain just a little bit. How many times have doctors gone on strike in the last, let's put it in the last 4 years? Can you remember?
At least few times,
okay.
Or even a lot of times, even a threat strikes.
Okay.
But at least they have somebody that intermediated and suspended their strike.
Okay. And some of the issues raised whenever they strike, are they recurrent or not?
But this is what we are saying.
We're talking creating what's it called now? Provision of tools to work with. Little wonder every time they always try to make comparisons or draw comparisons that we have leaders that are resident in Nigeria and say they lead us in Nigeria, but they rather choose to go outside the country to go and seek medical care. That alone drives home the point that maybe the hospitals are not even well equipped for them to function optimally.
They are not well equipped because of poor government policy.
Interesting.
Recently, there is this Gambian parliament videos that is spreading now, how the parliamentarian, the woman was airing her view. Now Nigerians were sharing it too. How she said, we should not be allocating benefits and wealth to us, so that we should consider the people. Can we, for us, all Nigerians, choose to consider Nigeria first?
Okay.
Let us be honest to ourselves.
All right. So bottom line is they shouldn't leave Nigeria. They should stay in Nigeria.
They shouldn't leave Nigeria. Rather, they should come together, form a coalition, vote out all these leaders, vote in fresh leaders that we consider the basic amenities of life. We running and traveling will never be the solution. As they are traveling, when they come back, will the Nigeria change? Nigeria will wait for them now.
All right, then. Thank you. Thank you so much, Mr. Zion. 2 questions on the table this morning. Did I say morning? Forgive me, this afternoon. Which should be of utmost priority to a doctor, especially a Nigerian doctor? Greener pastures or staying put, like Mr. Zion says, to save human lives, seeing that we're in short supply of doctors, as it were. And parents, you can help us answer this question. your teenagers that are looking to get into the university, are they still excited? Do we still feel the enthusiasm about studying and practicing medicine in Nigeria? Okay, so you either study medicine in Nigeria, you study medicine outside Nigeria, but the bottom line is you would have the 093 numbers again is 0809 030 6416 from Ozoba. Emmanuel.
The government will begin to spoil the people up and down and all that. They will owe them and all, they will not pay and all that. So at the end of the day, you see that there's nobody that their parents sold their property to them and what they want them to receive. And there's no other way they can do it other than if they have opportunity to travel out. So the bottom line is that the people deserve it. The Nigerians deserve what they get. Election is coming up now. You see them campaigning for Tinubu and campaigning for Atiku. At the end of the day, the same thing will continue. The same thing that is happening will continue. Instead of voting people, that will solve the
let's not make this about any political candidates now. I think the word should be voting in the right candidate. We don't know who is the right candidate.
Because these are the people that have brought us to where we are. And that's really clamoring. What else are they bringing to the table other than what has been given to them? So the people deserve what they want, what they get. If I'm a doctor, I will not take, after graduating, I will not spend 1 month in this country.
All right. Thank you so much, Emmanuel. WhatsApp messages. This one says, "Good day, DDN." Who is N? For me, the priority for doctors should be to save life. It's an oath they willingly took on their induction to medical association. But DD, it's actually DDW if you want to abbreviate. While they are saving lives, their own lives also need to be saved through payments of their salaries and all. For me, I fought for you. Funny enough, our policy would travel abroad for medicine, only for the same Korean doctors to attend to them over there. Funny. Timothy Yaba from Abloma Road. Good afternoon, Denise. The oath says to the best of my ability, meaning there's a limit to what they can take, especially in a country where the government does almost everything to frustrate the noble effort of our citizens. That said, if I remember correctly, when the issue of doctors leaving the country arose some time ago, the current Minister of Labour and Employment once said, "We have more than enough doctors in the country." I laugh. From Wes. Wes, is this a comedy show? Good afternoon. To me, the doctors are right because they work more and are being paid less with less or no equipment. Our politicians go outside the country to take care of their health while we have good and qualified doctors here in Nigeria. 070 0923 0923 070 0923 0923. WhatsApp and Telegram number 0809 030 6416. If you're just joining us, it is the sunny side on your number one station for talk 92.3 Nigeria Info. We're talking medical consultants leaving Nigeria in search of what we call greener pastures. And my questions are, which should be of utmost priority to a doctor, greener pastures or saving human lives? And are young Nigerians still enthusiastic about studying and practicing medicine in Nigeria? A Facebook message this one is from Ojone Justice Ogu, and it says, everything in Nigeria has been politicized. There's no country all over the world that people don't seek for greener pastures. Go to Abuja, Lagos, Kano, and see hospitals that are owned by foreigners, and also many hospitals owned by Nigerians have foreigners as workers. Interesting. So I'll just go over what the report says, and then we'll go on a commercial break. When we come back, I doubt we'll have enough time to get back to this conversation, but notwithstanding, you can continue to drop your messages on Twitter and on Facebook. So this is it, yeah? The Medical and Dental Consultants Association of Nigeria has shown that 9 out of every 10 medical and dental consultants with less than 5 years of experience plan to leave the country for greener pastures. The survey carried out in March 2022 by its Medical Education Committee also found that over 500 medical and dental consultants had left Nigeria for developed countries over the preceding 2 years. The association made this known in a statement signed by its president, Dr. Victor Makajwala, and made available to the Punch newspaper as at yesterday. Disturbed by the impacts of this ugly trend in our country's health sector growth and development, the Medical and Dental Consultants Association of Nigeria has conducted a survey among its chapters in March 2022 and found that over 500 medical and dental consultants had left Nigeria for more developed countries over the preceding 2 years. Now, this is where the conversation sets in. They also reported that only 24,000 doctors are currently registered to practice in Nigeria, given a ratio of 1 doctor to over 8,000 Nigerians against the World Health Organization's recommended ratio of 1 doctor to every 600 people. We go on that commercial break, and when we come back, we round off. Just stay tuned to us. We are Nigeria Info.
It's all talk and no seatbelt.
The country to the UK are going there to replace the doctors that are also leaving the UK for Australia because of better working conditions of medical practitioners in Australia. The moment is not only in Nigeria. Nigerian doctors are going to UK because there's a dearth of doctors in that country too. DJ from Port Harcourt. Okay, sorry. Trending stories come up at 1. Unfortunately, this is all we have time for this conversation on the sunny side. Remember, the conversation continues on social media. Twitter at NigeriaInfoPH, Instagram at NigeriaInfoFM_PH, and Facebook Nigeria Info 92.3 PH. Just stay tuned to us. We are Nigeria Info.